Good afternoon, one and all. Uh, Today we are going to talk about NSAID and kidney. So before that, I would like to introduce myself. I am Dr. Vinod Nagesh, consultant nephrologist and transplant physician working at Chandray Hospitals. So dealing with nephroimmunology department. So today is a special day for all kidney and all individuals and especially kidney patients, because second Thursday of March every year is celebrated as World Kidney Day. And the theme of today's World Kidney Day is kidney health for all. Why this kidney is important to us? What are the normal functions of the kidney? There are usually every individuals will have two kidneys over the back. These kidneys, the main function of the kidney is to filter the blood and remove all waste products that are present in the blood. This is not the only function of the kidney. It also does balancing your fluid in the body, balancing your electrolytes in the body, balancing your acid-base status in the body. It also produces a lot of hormones for blood production and for growth and so many things. So we know the kidney diseases, the prevalence is increasing nowadays. So this is a high time, especially on this World Kidney Day, to create a public awareness among the risk factors for the kidney damage. As we all know, one of the risk factors is use of painkiller medications. Today, I'm going to talk about these painkiller medicines and the relationship between the painkiller medicines and the kidney, with the question being asked, do painkillers damage the kidney? What should I do to take care of my kidney? See, an analgesic, the meaning of the word analgesic means any medicine that is used to alleviate pain. So we all know there are a lot of painkiller medicines available belonging to different groups. We have several classes: non-steroidal anti-inflammatory drugs, steroids, and opioid analgesics, and non-opioid analgesics. There are several groups of, and every painkiller medicines will have their own potency and they have their own efficacy in alleviating the pain. Apart from relieving pain, it also has other benefits, like it alleviates inflammatory process. These medications are boon because they treat pain in those patients who have incruciating pains. But these medications, especially what I'm going to refer today, is discussing about NSAID. The full form is non-steroidal anti-inflammatory drugs, like acetaminophen, ibuprofen, naproxen. Like, there are several classes and several medications are there in this list. They have been inflicted to cause kidney injury. That means kidney damage. And when we see the statistics, these drugs are used by 1 in 3 individuals when you see on a community basis. But not all develop kidney diseases. There are certain high-risk individuals who develop kidney problems secondary to the use of these medications, which I'm going to tell subsequently. But sometimes these medications are dangerous to the kidney. So we are also taking these medications regularly over a long period of time is going to cause a permanent damage to the kidney, because most of these drugs are excreted. The metabolites, they have to be eliminated by the kidney itself. So ultimately, it can cause damage to the kidney. So as I have told you, today I'm going to specifically talk about the NSAIDs. The most commonly available NSAIDs over the counter are ibuprofen, mefenamic acid, diclofenac, acetaminophen in various brands, various companies in various brand names, nimesulide, celecoxib. Before understanding how the damage caused by these painkiller medicines on the kidney, we have to understand how the kidney functions and what is the mechanism by which these medications are going to harm the kidney. So we all know that this is a kidney which I'm showing here, and blood flows into the kidney and blood flows out of the kidney. Within the kidney, there are several filtering units called nephrons. They are just like blood filters. the one which is shown here, which we call in medical terms as glomerulus, which acts as a filter in the kidney. And each kidney will have 1 million filters or nephrons. And the blood flows into the kidney and blood flows out of the kidney. And in between, there is a filtration happening, and all waste products are passing through this Bowman capsule, and ultimately it comes out as urine. See, ultimately, the body has a mechanism to maintain this filtration uniform. For example, whenever we have a vomiting, gastroenteritis, loose motions, there is a sudden decrease in the fluid content in the body. Suddenly, what happens whenever there is less fluid in the body, automatically the blood flow to the kidney also decreases. In such case, the kidney has an auto-regulatory mechanism to protect, to maintain this filtration. What it causes? It causes constriction of the efferent arteriole, that is the one which goes out, so that the blood pressure increases here and maintains the filtration. Or it can cause dilatation or the increase in the size of the afferent arteriole, which allows more blood to flow in. So we all know that these mechanisms are overworking in certain conditions like heart disease, trauma, liver diseases, whenever the body fluid is less in the body. So this we talk about the efferent. When we see the afferent arteriole, whenever the water content in the body is less, so there is dilatation, we call it as widening of the afferent arteriole, so that the more blood comes in. So this is the mechanism which maintains the filtration. So when we use this NSAIDs, which mainly blocks the synthesis of prostaglandins, and thereby this autoregulatory mechanism is lost. So what is it? The autoregulatory mechanisms are maintaining the filtration and maintaining the normal kidney function, especially in those stressful states. And in such scenarios, if we take NSAIDs, that is going to abolish the autoregulatory mechanism. And in addition to this, if we take other tablets like renin-angiotensin blockers also, this is going to augment the damage, and the filtration pressure is going to drop suddenly. So the capillary pressure is going to fall, which results in kidney damage, acute kidney injury. This is the mechanism how the kidney is going to be damaged. So NSAIDs and kidney, there can be two types of damage: acute kidney injury and analgesic nephropathy. Acute kidney injury is anything that causes kidney damage over a period of days. That means that there was no kidney problem previously, and now the patient has come to you with a problem in the kidney that is rising creatinine over a period of days. This is called acute kidney injury. Another condition is called chronic kidney disease, means the damage is persisting over a longer time, that is weeks to months. That is usually manifested as nephropathy. In chronic conditions, the kidney is going to shrink, like as it is shown here, and this shrinking process is irreversible. So acute kidney failure, which can happen suddenly with these medications. And as I already discussed, usually these patients will be dehydrated. They will be having underlying risk factors like alcohol abuse, lupus patients, and already who have an underlying kidney disease. So this chronic kidney disease can happen if we use painkiller medications for a longer period of time. And this usually causes chronic kidney disease, which can progress to end-stage renal disease, where we have to initiate dialysis or we have to go for a transplant, as this is irreversible. So what are the risk factors? Which are the group of patients where these medications produces a higher risk of kidney damage? Those patients who are suffering from heart-related problems like congestive cardiac failure, those who have a liver problem, which you call it as liver cirrhosis, age, especially elderly individuals, age more than 60 years, patients who have diabetes, who have hypertension, especially those who are uncontrolled, patients who are already suffering from chronic kidney disease, where the kidneys are functioning less. In the top of it, if you use painkiller medications, that is NSAIDs, that may further worsen the kidney damage and progressively can reach end-stage renal disease. Certain rheumatological conditions like systemic lupus erythematosus, these patients are also that itself can involve the kidney. In addition to it, if we use NSAIDs, that can also cause acute kidney injury. So we all know. So basically, we came to know how these medications are going to cause the damage and to what extent they can cause the damage. Always in clinical medicine, the prevention is always better than cure. So here, the main dictum is understand. We have to create a public awareness. Before you use any medications, take appropriate consultations. Without doctor's advice, don't self-medicate, especially with over-the-counter painkillers. And you can always consult your doctor, a nephrologist, to use kidney-safer painkiller medications when you have an intractable pain. If the patient takes NSAIDs and develops a kidney problem, you have to approach a nephrologist as early as possible, where we have to initiate the treatment at the earliest, because kidney is one such organ where the time is money. Early the treatment, more the kidney can be saved. Later the treatment or delay in treatment means we can preserve the kidney to a lesser extent. And absolutely, when the patient approaches us, first thing what we do is stop all these medications which are causing the kidney damage and treat them and help the kidney to recover. If the kidney is severely damaged, may even require dialysis. If kidney is permanently damaged, may require a permanent dialysis or a kidney transplantation. So the take-home message is from the kidney point of view, prevention is always better than cure. As I have already mentioned, high-risk individuals should avoid NSAIDs, painkiller medications, self-medications, and over-the-counter painkiller tablets. So without doctor's advice, don't take these medications for example, for any pain-related matters. So consult nephrologists for risk assessment and use of alternate kidney-safe medications so that the pain can also be alleviated and the kidney can also be protected. So with this take-home message, I wish you all a very good health. So take care of your kidneys. If you have any kind of a kidney problem or you need a consultations, we'll be there at Chandra Hospitals. Thank you. Thank you very much.